Oh, how do I get that here?
Oh, you got it.
Just do it over here?
Call to order.
Yeah, but does this branch out at all to tell,
I think it.
I mean, does this have its own?
Because I don't see it here, but I think you just follow
That's
what's up
it.
there.
Right.
Got
and,
that?
Yeah,
Yeah.
follow along there.
Okay,
Yeah.
got it. Okay, so we're going to call this meeting to order. Good morning, everyone. I would like to, first of all, everybody's here. This is amazing. And we'd like to welcome Carol Walker, who is new. This is her first meeting. She's from Ward 4. And next to her, you met her last time, but I wanted to reintroduce as Janine Paquin. Jeannie, sorry, Jeannie, thank you. So that we'll get going. So we're going to do the roll call, and does Cindy do that?
I will.
Yeah, okay.
Kristen Lee. Here. Kim Spoon.
Here.
Barbara Sterling.
Here.
Carol Walker. Here. Jeannie Packard. Here. Andrea Pelton.
Here.
Kyle Baxter. Here. We have a quorum.
Great, thank you. Okay, now we're going to go into public comment, and we have 3 this morning. Just a little reminder that the members of the committee cannot take any or ask any questions from the people who are doing their public comment. So I just wanted to bring that forward in case, for expectation issues. So our first person on is Norm Metcalf.
The microphone's turned on for you already.
Okay.
Good morning.
Good morning. Hope everybody's doing fine. Okay, my name is Norm Metcalf. I'm 82 years old, one of the 20 to 30,000 senior citizens in Spark. I'll ask you to forgive my appearances. My three-piece suit days are long past. And one of the things that I want to address is that first, in your package, you have a thing that the county finally started issuing just this quarter. And it has, well, the food menus, but it also has other resources for senior citizens. And that's the reason I'm here, is that I'm proposing that Sparks does one similar. One of the reference points in here would be referring back to this for resources, but also in your package, I just had a draft, shall we say, of 3 or 4 pages of different ideas. But what it's intended to do is to cover specific things that's available for senior citizens for resources. So the first thing on, it's a page like this, the first page, I suggest that to change the title that I had listed as Sparks Service Senior Citizens Resource Central. And it'd be issued hopefully on a quarterly basis. That would have, as I said, this would be referred to in there as a resource, but also other resources. And I just laid out some because from my perception, there are 4 groups or categories of senior citizens. One is the homebound. My wife was that before she passed away. Those people that transportation isn't that important, but they're hard to get information to. The second one is non-homebound, but I call them transportation challenged. A gal was talking to me the other day and said, well, she had to pay $60 get to her doctor's appointments. The third category is people that have vehicles that can get around, but are limited to local areas. They won't be like me and drive. They'll drive to the local Walmart, Smith's, etc. And then the fourth category is me type, where I'll drive to Pyramid Lake, Fernley, Carson City, wherever, Tahoe, that type of thing. So that's,
Mr. Metcalf, I'm sorry, but it is the 3-minute limit,
okay,
and we have reached that. so-
Okay.
And I'm sorry, I should have mentioned that to begin with as well, so I apologize.
so I guess I will go and come back again to finish.
And thank you. And Andrea was stating, Mr. Metcalf, you could also come back on the public comment at the end
Yes,
if you'd
I'll
like
come
to
back.
stay. Okay, thank you. Okay, the next person we have is Pamela Baker.
Good morning, I'm Pamela Baker, I'm age 70. I'm a disabled veteran, and I'm one of those that's unable to drive due to my military service-connected disability, so I ride public transportation. I'm asking the commission to continue subsidizing the RTC Flex Ride for Spark seniors, and add also that it considers subsidizing for free the RTC Access, which is public transportation exclusively for disabled. I'm asking that the Sparks Senior Center get the same amount of services that the one in Reno gets, because we don't. I'm asking that the information that's posted at the Sparks Senior Center be current, because it's not. 99% of it is, but there's some of it that isn't particularly relating to transportation. And number 4, I'm asking that for safety and health reasons, that the ingredients and nutrition information for senior meals be publicly posted for those with food allergies, watching their weight, have drug interactions, etc. And last but not least, the food is terrible. Thank you.
Thank you. Okay, the next in line is Timothy Johnston.
Good morning, all. Timothy Johnston, Vice President of Outreach for Better Business Bureau. For the record, I often talk about scams and want to let you know about a new service or a resource that we have available on our BBB Scam Tracker. Now, we know that scams often have a serious financial consequence, but they also can impact and have a negative impact on our emotional and mental health. Oftentimes, knowing what to do can be very stressful for an individual, so we want to make it easy for that person to know what to do, and we can help. Our Scam Survival Toolkit provides tailored guidance and resources based on a person's specific situation. So it's built on simple questions that lead you to a list of action items specific to whatever happened to you, whether it's your identity has been stolen or for some reason your credit card has been used and you're wondering what happened there. Now, the toolkit can be found on our homepage for BBB Scam Tracker, and that's bbb.org/scam tracker. So I encourage you to check it out. One of the things that we hear a lot about are data breaches, which often lead to identity theft. And how does Nevada rank? Well, if you attend many of my presentations, there's one this afternoon at 2 o'clock at the Washoe County Senior Center. Nevada ranked 3rd when it comes to identity theft reports in 2023. One thing that Better Business Bureau does in our community is we host an annual free shred event. This year will be our 17th annual BBB Secure Your ID Day. It is on Saturday morning, October 12th, from 9 a.m. to 11:30 a.m., or until the shred trucks are full. It takes place in the west parking lot of the Atlantis. You can shred up to 3 boxes of documents for free on site. We also gather food and funds for the Food Bank of Northern Nevada. Last year, we gathered enough food and funds to provide almost 10,000 meals for our community. So I encourage you to check it out. Got any questions, you can always reach out to me. Go to bbb.org/SYID, and then also pay attention to 2 News Nevada, as they are our media partner for the event. Thank you.
Thank you. Okay, now, that is it for public comment. And we will go on to the approval of the agenda. Have a motion?
She got,
I keep getting knocked off.
Cindy,
Cindy? I
she's
keep getting
logged out
knocked off.
again.
Oh, yeah. You're special.
It's broken. Who sits here?
Okay, Andrea Pelto will make a motion to approve the agenda.
Okay, thank you, Andrea. Do we have a second?
Thank you.
Do we have a second to approve the agenda? We have to push our buttons.
I made the motion. Somebody else to second.
Barbara Sterling, make a second motion there.
Got it? Oh, sorry. Okay, thank you. All in favor of approving the motion?
We have to prove.
Go ahead and hit yes. All, any not in favor? No? And anybody who wants to abstain? Okay,
Comes up there.
great. It is 7 for yes. So the motion is passed. Okay, now we're going into the current items. 5.1, consideration on the agenda, consideration and possible approval of the minutes, which we just,
No, we did the agenda.
the agenda. So consideration and possible approval of the minutes of the Sparks Senior Citizen Advisory. This is hard for me to get the, okay. So there, see, that's why I was asking before. Yeah.
Same thing.
Okay, I didn't have it on here, so there we go. Thank you. Okay, now I get it. 5.1, consideration and possible approval of the minutes of the Sparks Senior Citizens Advisory Committee meeting for February 28th. Do we have a motion to approve as is?
Andrea with some corrections. So, for the record, and the minutes I have say May 22nd. Was it these were the May 22nd meeting minutes? Yeah, I'm not. So my first correction is that it should say the May 22nd, 2024 minutes, not the February 28th that it says. First correction is several times in the minutes is listed senior rescue. Rescue is spelled capital R-E-S, capital Q. That's the name of that organization. So that's on page 3. And then on page 6, item 8.2, Spoon said, presentation by Brett Janelle. It's not Jewel, it's Janelle, capital J-U-N-E-L-L. And then in the second paragraph, it was Pelto. Again, senior rescue is mentioned twice. And then it should say first ever hospice guest house. So also on page 6, Northern Nevada Center for Independent Living, their program is called STRAP, capital S, capital T, capital R, capital A, capital P. And then lastly, or not lastly, sorry, on page 7, Marcy Cooper Smith, Marcy is spelled M-A-R-S-Y. And lastly, at the very end, written with Sheriff Balaam. Balaam is spelled B-A-L-A-A-M. And so I make a motion to approve the minutes with those changes.
Are there any other changes anybody else noted before we go? Okay, great. So can we have a second for that motion?
Kyle Waxman, I second the motion.
Okay. Everybody in favor of approving the agenda with the changes presented, please.
Oh, okay. Yes, it says-
Okay, there we go. Please press yes or aye. Any noes or abstain? And it is one abstain and 6 yes. So the motion is carried with the changes as stated. Thank you, Andrea. Okay, so now we're going to agenda item 6.1, which was introducing the new city manager, Dion Luthane. Is that Luthane or Luthen or Loth? Oh, completely wrong. Okay, thank you.
Morning, everyone. Dion Louthan. Just wanted to say thank you for having me here this morning. I'm the new city manager for Sparks. I've been here almost 3 months, but thank you for your volunteerism. Thanks for engaging and being a part of the community and trying to be voices for us, the eyes, the ears, to bring information back to us for us to consider. And just wanted to let you know from my chair, anything that we can do to help support you and set you up for success, let us know, and we would be happy to do so. But happy to entertain any questions or anything like that. Just wanted to come over and say hi and welcome you and appreciate all you guys do.
Thank you. Kim Spoon, for the record, do have just a quick question, and I know I've read all this, but where did you come from? I can't remember.
My last stop was in Roseville, California.
It was Roseville. Okay, I wasn't sure if I had you mixed up with someone else or not.
And then spent some
Yeah.
time in Southern
Long
Nevada.
ways away.
Yeah, right. So, and then spent about 15 years in Henderson, Nevada, too.
Oh, okay. Thank you. Other questions?
Andrea Pelto, for the record. No question, just a comment that I was able to spend quite a bit of time with Mr. Luthen.
Louthan.
I'll get it eventually.
All good. All good.
And I know that he's very approachable, and I really appreciate him sharing his talents with the city of Sparks.
Thank you. Very kind.
Thank you. Appreciate you coming.
Thank you.
Okay, go on to 6.2, and we're going to be doing our presentations now. We have the Sparks Public Engagement Survey results.
Good morning, members of the board. For the record, I'm Allison McCormick, your Assistant City Manager. Back in June of 2023, so a little over a year ago, the Sparks Equity and Inclusion Advisory Board, so one of your fellow boards and commissions, recommended to the city that the city conduct a resident survey. That is the first survey of residents that we've conducted, at least in my tenure here and in any recent memory. Following that recommendation, the City Council approved a proposal from ETC Institute to conduct a survey of our residents that would be statistically sound. I am presenting those results to you today. The survey was conducted between January and March of this year. I'm going to skip through some of these slides pretty quickly. Some of them are more about the vendor, ETC. This is the same slide deck that they use to present to our city council. So I'm going to try to focus on the things that I think might be of most importance to this group, and feel free to jump in with any questions if I move past something that is of interest. The purpose of the survey was to get input from residents about how satisfied they are with the city's services, to compare the city's performance with other agencies, both regionally and nationally, and to help determine priorities for the city's future. Again, this was the first resident survey conducted for the city. The survey was sent to random households by mail and online. Each survey took about 15 to 20 minutes to complete. We ultimately received 571 completed surveys, with at least 100 surveys from each of the city's 5 wards. And the margin of error was what's consistent in this line of work. This map just shows within about a block where all of the survey respondents reside. So each red dot is the approximate location of one survey respondent household. Just to give you the highlights before we dive in, residents really are positive about the city. 84% of survey respondents said that they were either very satisfied or satisfied with the city as a place to live. That is more than 30 points above both the US and regional averages. Most respondents also said they feel like the city's headed in the right direction. That was 63% agreed with that statement, and 79% of respondents said they were either satisfied or very satisfied with overall quality of life in their own neighborhood. However, they did help us identify 2 top priorities for improvement. Those were the condition of streets, pavement, and sidewalks, and the enforcement of city codes and ordinances, so code enforcement. I know this font is pretty small, so I'll just hit some of the highlights. The blue indicates that respondents were either satisfied or very satisfied. The dark blue is very satisfied, the lighter blue is satisfied. Yellow is neutral, and then the pink is dissatisfied, and red is very dissatisfied. So you'll see at the top, we've got a great majority of people who are satisfied or very satisfied with the city as a place to live, with quality of life in their neighborhood, or quality of life in the city of Sparks. Folks like raising their families here in Sparks, which is a point of pride for us. However, some areas of concern are affordability of housing in the city. Just over 20% of respondents were satisfied or very satisfied, with nearly 50% of people being dissatisfied or very dissatisfied with affordable housing options. The city has very little control over education systems, but people aren't thrilled with the quality of education in the region as well. Potentially of importance to this group, a majority of people, 66% roughly, were either satisfied or very satisfied with the city as a place to retire. Overall satisfaction with city services, people were over 80% of respondents were either satisfied or very satisfied with fire and EMS services. Mowing and trimming along city streets and parks is one area for potential improvement. That's here in the middle. Roughly 50% of people are satisfied or very satisfied with that, but we've got some pretty substantial dissatisfaction with those services. One area I will highlight is the condition of streets and pavement. We've got a pretty substantial group that's either neutral or dissatisfied with those services, and similar with code enforcement here at the bottom. This map highlights responses on average regarding the condition of streets, pavement, and sidewalks. The yellow areas responded on average neutral. The blue areas responded on average satisfied. And then this one orange area down here in Ward 1, it's part of the older part of Sparks, on average responded dissatisfied. So that may suggest, as at least one data point, that that's somewhere where we ought to invest some of our dollars as far as paving, revamping our streets and sidewalks. This map shows code enforcement satisfaction using that same legend. Again, most people on average are neutral on their satisfaction with code enforcement. We've got a couple areas up here in Northeast Sparks and over here in Ward 3 that are on average satisfied with code enforcement, and then this one neighborhood is on average dissatisfied. So that might be an area to target. I do not. Sorry. This graph just shows the percentage of respondents who said that they think that Sparks is generally headed in the right direction. Just under 2/3 of folks feel that the city is headed in the right direction. Would love to see that number tick up higher. We also asked about some services that the city really doesn't have control over. So access to groceries. Most people, almost 92%, feel like they do have good access to fresh groceries near their home. Good access to internet, decent access to healthcare, and then this line at the bottom, actually, in this instance, we're happy to see this red and pink here because it's folks indicating that they disagree or strongly disagree with the statement that they were worried or stressed about money to pay necessary expenses like rent and food. So disagreement with that statement is a positive sign for us. We can skip through that one. I'd like to show some comparisons to regional and national averages now. The yellow is the the regional average on each of these statements. The red is the national average, and then the blue is Sparks respondents. So we are crushing it as far as Sparks as a place to live compared to both regional and national averages. Same with quality of life, roughly 30% above comparators, and well above the city as a place to raise a family. As far as a place to retire, the city is just under the regional average and substantially above the national average. Overall quality of services, we are outpacing those averages as well. Fire services, we are also outpacing substantially the national and regional averages. EMS services, a little bit less, but still to our advantage by between 15 and 10%, depending on which average you're looking at. Parks and recreation facilities and programs is a point of pride there as well. 67% of respondents are happy with those services, whereas the regional and national averages are 47 and 49% respectively. Police services, we are right in line with comparators, slightly above. Emergency preparedness, which I think you may hear more about later today, we are slightly above. And then communication with the public. We would love to see that number be, 75, 85%, but we're still well outpacing the national and regional averages there. Our vendor ETC Institute also helped us identify some priorities for future investment. They use a methodology that they call an importance satisfaction analysis, where they weigh how satisfied folks are with certain services against how highly they rank them in importance, and they squish those numbers together and identify a couple priorities for us. So a lot of respondents said that condition of streets, pavement, and sidewalks in the city should be either the first, second, or third priority for the city moving forward. 63% total said that that was a top 3 priority. Similarly, code enforcement, 39% of folks identified that as a first, second, or third priority. Police services is right there as well, with 39% of folks identifying that as a first, second, or third priority. However, satisfaction with police services as they are today was ranked higher generally. So based on that importance and satisfaction comparison, they have recommended that the city focus on the condition of streets and sidewalks, as well as code enforcement efforts in the future. Looking at communications, people are generally very satisfied with the city's website. So that is a positive point. A lot of folks interact with the city on a regular basis. So many people reach out just with a question, who takes care of this street? How do I get my street swept? Those kinds of things. 28% with a request, 28% with a complaint, and 5% with a compliment. Again, we'd love to see that number go up in the future. People are generally satisfied with how easy it is to contact the client relations and customer service departments, as well as the level of courtesy they receive and whether or not those employees were able to assist them. A couple of key points for where people get information about the city. Local news is still top. That was surprising to me from these survey results, but an important reference point, Julie Duell here does great work getting information out to our local news outlets, and we need to continue those efforts because that's where most people are getting their information. And secondarily, the city's website, more than 53% of folks get information from the city's website on a regular basis. In summary, again, 84% of respondents said that they were either very satisfied or satisfied with living in the city of Sparks. And most people felt like the city's heading in the right direction. But we've identified those 2 top priorities, condition of streets, pavement, sidewalks, and code enforcement as top priorities for the future. With that, I am happy to answer any questions.
Thank you, Allison. I have this is Kim Spoon for record. How did you decide? I'm just curious on the ETC to do the actual survey. How did that work?
Yes, Allison McCormick, for the record, we did a request for proposals, put it out to the public, sought responses from vendors who do this type of work. If I recall correctly, we got 5 or 6 proposals, and based on references, cost, and methodology, we selected, a panel of city staff selected ETC Institute as the recommendation, and we took that forward to City Council for their input and ultimate approval.
And real quick, I don't remember seeing it, because I did look through this really quickly, but did the surveys ask what age the survey takers were? Do you have an idea of the age group that actually did the survey? And how did they get the surveys? Was it all online, or?
So surveys were both mailed and available online to the select group of residents. The survey that was mailed included a link to the online version, including a version in Spanish for our Spanish-speaking residents. Roughly 30% of folks in Sparks speak Spanish at home, so it was important to us to get that group. And I believe that we attached the full survey report to your agenda packets, so that should be available.
Yes, I did, but I don't remember, I just didn't.
Hold, please.
We're holding.
I know that we did ask that question. I don't know.
I would assume you did. I just don't
Yes.
remember seeing the results, because I would think that would have a difference on some of the answers to the questions. For instance, if it was a younger group, I would wonder if the website would have been
Sure.
different versus TV, just that sort of thing. I was just curious.
It is not cooperating to find that information easily in the report, but the full report of survey
Right,
results
I could
is
double
there.
check that. I was just curious, yeah.
Yeah, and to your point, if someone who is 25 and responding to the survey, I don't know that I care if they think Sparks is a great place to retire today.
Yeah.
That information, that demographic information is certainly relevant.
Thank you. Any other questions?
Barbara Sterling for the record. Allison, what do you mean by select group, and how did you select that group?
So the vendor, ETC Institute, selected that group. It was a random sampling, and how they do that, as a non-expert, I will do my best to explain. They get a list of all the residential addresses in Sparks, and they have some sort of algorithm or methodology to select a truly randomized sample of those addresses to get a full representation of the city. And then they mail many more surveys than the 571 that we got back, because participation in surveys isn't always high, to that random sampling, and then collect data until they reach the number that they believe in their professional experience is statistically representative of the city.
So they're only going by addresses? That's the only information they had, were addresses in the different wards?
That is all the information that I'm aware of them having, but I don't know the complete answer to that.
Anybody else? Well, thank you, Allison, really
Thank you.
appreciate it. That was quite the survey.
Thank you.
Okay, then we'll go to 6.3. Now we have a presentation by the Center for Independent Living, STRAP, STRAP, program update. Good morning.
Good morning. Thank you so much for having us here this morning. I'm Lisa Bonney. I'm the Executive Director of the Northern Nevada Center for Independent Living, and I didn't mean to touch your button. I do not have a fancy presentation, but I'm very excited to be here to talk with you about the STRAP program. And as you're probably aware, the STRAP program is for emergency assistance for senior citizens who are facing housing crisis. And I will tell you, quite frankly, when we received the funding, I was thinking, oh my gosh, this is going to be gone in an instant. And so I'm a little surprised. We received $40,000, and we're closing in, I believe, at the end of the year one, and about $10,000 has been expended. What this program has done is we've promoted it everywhere with social media and print, with the different senior resources that are all around Reno-Sparks area. And I was talking with my staff about any of the barriers that we have found that have been consistent. And one of the barriers is age. We have quite a few people come to us who are under the age limit, so they aren't seniors. And so they don't qualify for the program. And then the other thing that we found was that people were coming and they were needing things that weren't particularly written into this. And because you allowed us to be so flexible, we have gone back twice and adjusted the requirements for the program. In the beginning, we were only paying for rent that was, that they were unable to. I'm sorry, I haven't had any coffee, and my brain is just like, what do you want me to do? If they were having issues in making their rent, particularly if their rent had gone up unexpectedly, and we were covering moving costs if a person needed to relocate because the place where they were living was no longer affordable to them. As we know, a barrier to moving is it's expensive. Yes, so we've been inclusive of that. We've opened it up to be inclusive for utility assistance as well, because we were getting quite a lot of calls about that. And we felt like that is another way for people to be, at risk of losing their housing, as it's kind of a tier thing, one thing goes wrong, the next thing goes wrong, and the next thing goes wrong. But I will tell you that of the people that we have worked with, it has really opened a door, and this is kind of a selfish thing for me as a director of a program, to a lot of folks who didn't know that we existed. And by consequence of that, them getting connected to services that they didn't know were available. So I see that as a real win as we help you to try and spend this money down and to provide the services that we have discussed in the past together. It has been a really great thing for us. And I will give you an example. One of the programs that we have that people are just not aware of is the Helen Keller I Can Connect program. And this is a program for people who have hearing and vision loss. And it doesn't have to be, you don't have to be blind and deaf. It could just be that you're experiencing issues. And it connects people with not just equipment, but then the training to use the equipment. Which really helps to increase people's ability to remain independent in the community. And by virtue of this program, we have had conversations with people who didn't know about that program, because as you're talking to them and you realize they're having difficulty maintaining the conversation, and you start to ask them more deeper questions, you find out that they're really struggling with, they can't even process their mail because they are having trouble reading it. And so much is electronic now, and they don't have access to maybe an iPad or something like that. Or if they do, they don't know how to use it. And so we've really been able to bring some people into our world to do that. That's one of many things that a Center for Independent Living does. As we've talked with you in the past, our goal is to keep people independent, living in the community and living the life that they want to have independently in their community. So has this been the blowout that I was afraid of? I literally was afraid to announce this program because I thought, oh my gosh, it's going to be like that, and this is all going to be gone. So I'm surprised, but I'm gratified because I feel like it's really kept the door open for us to have these important conversations. If I could make a recommendation of anything, it would be that we just need to make sure that more people know who we are, what we do, how we do it. We are working with the different housing associations and the housing what am I trying to say? The housing authorities, sorry, and other organizations that provide the same types of services. We will be at the Senior Fest, and we will be pushing this program there as well, because that is, as we all know, hugely attended. And before I wrap up, the other thing, I'm just a tiny bit off subject, I promise you, Kim, but we are working with the Center for Disease Control, and we are a distributor of COVID test kits. If anybody you know, if your front office, if your desks, greeting desks and things need COVID test kits, we have them for free. And we're moving thousands of them because we are very concerned. So we cover all of Nevada except for Las Vegas. So if you know of anybody who wants to have test kits in their reception area, if they want to distribute them to membership, their members, anything like that, please get in touch with us, because we've got a very large program that's doing that. And with that, I would be very happy to answer any questions. Yes, ma'am.
Kyle Waxman for the record. You mentioned Senior Fest and the COVID kits. If you could bring boxes of them to the event, that would be fantastic.
We are planning to.
Great.
We are providing them for the people who are putting the event on to have at the very beginning when you come in. But we will also look for us, because we will have a mountain of COVID kits, because we really want people to have access to kits at no cost. So, better to test and be negative than to wander around wondering.
Absolutely.
Andrea
Hi, Andrea.
Belto for the record. So, yes, I want to thank you. I actually got a COVID kit when I was at your office a while ago, and recently found out that a friend of mine has COVID. And so I was so glad to have your kit handy to make sure that I did not contract it from her.
Excellent.
So thank you very much for
And
sharing.
we are very involved in coffee. We are very involved in emergency prep as well. So if we can ever be of any assistance with that, we have a very large program rolling out in September that we've been working on for over a year. That is links to a website that you can scroll through, and the website is searchable by emergency, it's searchable by disability, it's searchable by county. So you can say, I am a person that lives in Washoe County that's in a wheelchair that is experiencing a flood. Who should I be getting in touch with? It's pretty cool, if I have to say so myself.
And I'm sorry, you said that was Andrea Belto for the record. You said that was on your website?
It's going to be launched,
Going to
yes. Yes, it's going to be launched, but there's going to be a big push at Senior Fest also about that.
Okay, and I would also like to hook up with you and get a stack of kits to take out to the Sparks Senior Center.
Absolutely,
That's
absolutely.
Good. Kim Spoon for the record. I just have a question about, now you're coordinating with other, or have reached out to other agencies. How, I know with the city of Sparks and their housing emergency funds and programs they have, is that somebody that you have reached out to? Because I know, I'm not sure whether they got their funding as of, was it July 1st?
I believe so.
Okay,
Yeah.
so I don't know, and they run out quite quickly.
Right, we're
So-
kind of actually waiting for them to run out.
Well, that's so that you've coordinated when they do and if and when, and
Yes,
they can.
that
or
we're the backup, Dano.
Any other, yeah, it's a backup situation.
Right.
So that's good. Okay,
Right,
that's all I
definitely,
was curious
definitely.
about. Thank you.
But we really do, I want to thank you so much for entrusting us with the funds, because we know that you have a real desire to help our community and to make sure our seniors stay safe and housed. So we really appreciate the opportunity to do that with you.
Great. Thank you.
Thank
Good
you.
luck with that.
Oh, I have a.
Oh, I'm so sorry, Barbara.
That's all right. You spent 10,000 of the 40.
That's correct.
Okay, can you tell us where what?
Well, I can't give you names,
No,
but we worked with, actually, it almost comes out to $1,000 a person. We work, so far, it's been 10 different people. And the biggest thing has been emergency funds. So they've had an unexpected expense that has kept them from being able to make their rent payment that month. And then, everything is so fast anymore as far as evictions go, that it can go so quickly. And so we've been able to step in, pay their rent, Just so you know, they have to give us all the receipts and everything for whatever the expense was. And then the other thing that we're doing, this is interesting, well, it's interesting to me, is that we're getting ready to start the follow-up phone calls, because what we want to know is, did this intervention help people stay housed? I think that's a really important piece of information for you all to know, so that as we get other kinds of funding, we can understand, this works well. This program on the surface looks great, but it probably didn't have the effect that we wanted it to have. So it's good information for us. We learn what's really works, and we also learn that, maybe not so much. So we'll find out.
Oh, I wasn't, I'm sorry. I have another question.
Sure.
The last meeting we discussed with you, you were going to look, you were still studying about emergency vouchers. What have you done with that?
My housing specialist is in the Black Rock Desert right now, so she's not in the office. I can't answer that question because I don't know, but I can get back to you on it.
Okay.
And I'd be happy to get back to you on it before your next meeting.
Okay, that'd be good. And you mentioned there were other things too, the summer weekly special.
We ran that through our staff, and we weren't sure that was exactly the right place for us to be putting this kind of money, for the week-to-week properties. We're more interested in getting people out of that into some solid housing. The other thing that this program has done, as I said, it has opened our doors and conversations. We've really been able to work with a lot more people who didn't understand the housing search and how to look at it's different than when I was young. I mean, you opened the newspaper and you circled things and you went and looked. It's not like that now. And sometimes the older folks, like myself, kind of get lost in what the process may look like now. So it's given an opportunity for our advocates to be able to sit and work with people and assist them in helping to find, adequate housing.
Thank you.
Thank you.
I'd like to really hear about your results when you finish. I've asked you to please come back and tell us more.
Absolutely, yeah.
Because there's a part of the community that I see personally that is not being serviced.
And I would agree with you.
They don't know about your program.
I would
But
agree.
I'm really glad to hear that you're going to be at the Senior Fest.
Oh, absolutely.
That's a really important project.
Absolutely.
Thank you.
And we cruise the senior centers and all of that sounds bad. We go to the senior centers and, try to get the word out. And it's a tough crowd to communicate with. Because,
It is.
Yeah.
It's very tough because I know a lot of people who don't participate at the senior centers.
Right.
For a variety of reasons, but
Right.
one that we already heard today, that the food is just terrible.
Yeah.
But it would be very interesting to hear the results.
Well, we're interested because we're always, it's a learning experience, and is this a good idea, or is this an idea that has a couple of good points to it that that needs to be focused on, and we need to drop other things. And the only way you know is by circling back and asking questions to see what that money did. Guess I'm done.
Thank you very much. I appreciate you coming.
It's great seeing you. Thank you so much for the opportunity.
Okay, we'll go on to 6.4, and that's the presentation and review of Aging and Disability Services Division Programs and Services.
Good morning.
Good morning.
Let me pull up my PowerPoint really quick. I'll introduce myself while we're waiting. Good morning, I'm Autumn Blattman. For the record, I serve as the Washoe Regional Coordinator for Aging and Disability Services Division. So just a quick overview of my position and why I'm here today. Andrea and I have been going back and forth trying to get me on the agenda for a while, so I'm so happy and thankful that I could be here today. My position serves as fairly new. I've only been around for a year in this position. And really, I serve as a liaison between the division and the community. So part of my job is to educate the community about Aging and Disability Services Division, and also to hear the concerns and the feedback from the community in order to ensure that we can look at potential policy change, whether that be talking to community partners and convening services through other organizations, helping bridge those gaps in services that we see in the community. So today I'm just going to go over our division services. Please feel free to interrupt me if you have a question pertaining to the program, because we have a lot of services that we have through our division. But really, our mission is to ensure the effective provisions and supportive services to meet the needs of individuals and families, to make sure that they're leading independent and meaningful and dignified lives. We do serve the lifespan, which people oftentimes get confused of because our name starts with aging. But we do serve children with disabilities as well as adults with disabilities, as well as older adults, including also family caregivers. I forgot to mention that as well. So we also serve clients directly through our programs as well as through community partnerships. And we grant fund, I believe the last number that I remember was $28 million out to the community for community partners to provide services within their local areas. So I know that this is a senior advisory board, but to go into some of our children's services, because you may know somebody who needs early intervention or needs child related disability services, I'm just going to quickly review our children's specific programs. One of them being Nevada Early Intervention Services, which provides intervention services to families and children with children who are 0 to 3 years old who have developmental disabilities or delays. And so this is a program, it goes into the least restrictive environment, so going into people's homes or to the playground to help with developmental milestones, and also providing service coordination, special instruction, different types of therapies, nutritional services, vision and hearing services, and family support, and much, much more that I'm not even touching on, but that's kind of the base. We also have the Autism Treatment Assistance Program, which assists parents and caregivers with the expense of providing autism-specific treatments to children with autism spectrum disorder. And I believe it's also young adults. I think it's to the age of 19 or 21. So it is slightly above the 18-year-old age. They do kind of on a sliding fee scale support those treatments, but a lot of people who come up to me at tabling events, they're very interested in this program because autism treatments are really expensive. Going into kind of the disability side for Lifespan, we have 3 regional centers in our division, and they provide developmental services. So we have Sierra Regional Center, which is serving the Washoe County area, Desert Regional, which serves the Southern Nevada area, and then Rural Regional Center, which serves all of rural Nevada. They support individuals with intellectual or developmental disabilities any age, so 0 to end of life, for disabilities for developmental delays, developmental disabilities, and intellectual disabilities. And this includes behavioral consultation, service coordination, respite services, family support, jobs and day training, nutrition, support of a living arrangement if that's needed. And these services are for the individual's life, so they can receive them forever if that's their choice, and really to help lead independent lives in the community.
Real quick, though,
Yeah.
Kim Spoon for the record, do you want us to interrupt you
Yes,
through
please-
it?
please do.
Or at
Yes.
the end? When it's an adult, even a senior that gets these services, do they have to be diagnosed before they are 18 or 21?
Yes, it's
That's what I
thank
thought.
you, Autumn Blattman for the record. So it's before the age of 22. However, if an individual feels that they have a developmental or intellectual disability that was never diagnosed, they can do a historical record review and look at even school records, because as we know, the education system has changed and disability diagnosis has changed over the years. So especially with our seniors, they may have a developmental or intellectual disability, but they were never actually diagnosed with anything because of the way that their school system was set up back then. So I would always encourage people to reach out to the resource center if they feel, or the regional center, if they feel that they have an intellectual or developmental disability that wasn't diagnosed. But typically it is before the age of 22.
Thank you.
Yes. All right. These are our 3 regional center locations and their contact information with the links. So if you have the PDF version of this, it's all linked for you. If not, it's on our website for your reference. Okay, getting into more applicable services to you all. So we do have the Office for Consumer Health Assistance under Aging and Disability Services Division. This used to be called GovChaw, and people are somewhat familiar with that term. They moved it from the governor's office over to our division. And this assists healthcare consumers with, and injured workers with understanding their rights and responsibilities under their healthcare plan and workers' compensation. So typically what I hear OCHA kind of not investigating, but supporting with is workers' compensation, extremely high hospital bills. They can contact the hospital and negotiate bills or look at charitable foundations that can support some of the cost for the individual, if they have a lower income or they're struggling to make those payments to avoid collections. They can also answer questions regarding Medicare and Medicaid, and also doing some appeals with hospitals or doctor's office if somebody was wrongly charged for something. So this is an amazing resource. And they can also look at different programs for healthcare costs and resources for uninsured individuals. One of our largest services is adult protective services. This used to be called elder protective services, but I believe in the 2019 session of the legislature, we changed our service purview to not only be 60 and older, but to be vulnerable adults as well, so those with disabilities. And so this is 18 to 59-year-olds or 60 and over, so basically 18 to end of life. Adult Protective Services investigates abuse, neglect, exploitation, isolation, and abandonment. They also look at self-neglect cases, and self-neglect is not a crime, but it is important for those who may have dementia, cognitive impairments, where they may not be taking care of themselves as well. And if somebody has a concern, we absolutely would love for them to reach out to APS so that they can get some supports in the home. And so what our social workers do, or our adult rights specialists, they go out into the home when an allegation is made, and they just talk to the individual, and the individual has to be willing to accept services. And that's really important when we're talking about adult protective services, and that's our different, the way that we provide services is different than CPS, for example, because we're not able to remove somebody from the home. That is not within our authority. Our goal is to safeguard civil liberties. We want to make sure that people are safe, they're healthy, and that they're not being abused. And so if somebody accepts our services with APS, then we will do an investigation, sometimes get law enforcement involved if that's necessary, and really just provide resources to ensure that they can stay in the community or whatever the best level of care is for them at that time.
Kim Spoon, for the record, one of the issues that has been presented through the years is the fact that especially women, but it certainly can be men, are being exploited by someone who has moved in or helping out. And they're usually having some sort of early dementia or whatever, but they don't want these services because they think this person is great, which is part of the, MO. I mean, that's what they do. How can a person who goes in for protective services, do they kind of evaluate, do they bring in law enforcement at that point if they're not willing to accept services, but there's obviously an issue going on that they can detect? How does that work?
That's a great question. Autumn Blattman for the record. So from my understanding, not being in the APS unit, but from my understanding, when an individual declines services and they have the ability to do so, we have to respect that. And so unfortunately, if they want to continue in that situation, that's where the investigation ends. However, with the caveat, if there is cognitive impairments to the point where there may be questions of incompetency or capacity to make decisions for themselves, then we will bring in a contracted, I believe it's a psychologist, to come and do an evaluation for cognitive.
Do they have to approve that, though?
If they, that's a great question. I don't know if I believe they have to approve it, but if they're getting a psychological evaluation for cognitive capacity, I'm not sure what that process is. I can get back to you on that, though.
Yeah, that's just been a real problem.
Yeah, for sure.
because- Okay, thanks.
Yeah, and I would say always continue to report, right? There's no, it's helpful in the longitudinal perspective for APS when somebody can continue to report that exploitation happening, because then we log that, right? That it's continuing to happen over, a span of certain time, and then we're able to really evaluate, does the person have a cognitive impairment that's inhibiting their ability to make their own choices.
Thank you.
Andrea Pelto, for the record. Is there any thought to changing that? Because again, I went through that horrible time of a friend who had dementia that would not let anybody in, would not talk to anybody, and was burning down, the house and, doing all that stuff, and the hands were tied. So with dementia and cognitive issues being so prevalent these days, is there any chance that your organization would kind of revisit that? Because now we have so many people living that way.
Yeah, Autumn Blattman for the record. I'm not aware of APS specifically looking at changing anything related to what they're able to do regarding cognitive impairments. However, I do know that we were approved for funding for a dementia care specialist that we're working with University of Nevada, Reno on. And so, that is an absolute need in our community, is the prevalence of dementia and cognitive impairments. So we're hoping that these dementia care specialists will be kind of like resource navigators, but very specific to those living with dementia and cognitive impairments. So I don't have a lot of information on that program, but I'm happy to get that to you once I have a little bit more information from my chief, and see where maybe we can look at filling that gap. Mm-hmm. Yeah, absolutely, for sure. Another one of our big programs is the Long-Term Care Ombudsman Program, and these are advocates for residential facilities for long-term care. So this includes skilled nursing facilities, residential facilities for groups or group homes, homes for individual residential care, daycare centers, facilities and daycare centers meaning adult daycare, and facilities for long-term rehab, as well as providers of living arrangement services. So really what the ombudsmen do is they go into facilities, they educate not only the facility but the residents on what the rights and responsibilities are of the facility, and the rights and responsibilities of the residents, and really kind of uphold those rights. And it can be as simple as, I continue to tell the facility that I don't want to eat at 10 o'clock in the morning, I want to eat at 8. Right? And so kind of working back and forth with the facility to make sure that a person's life outside of the facility is very similar to in the facility. They do investigations if somebody is being abused, neglected, and exploited, and they oftentimes do work with adult protective services regarding those cases, again, if the person is willing. They do a lot of training as well to help our facilities know what their responsibilities are and trends and best practices. Okay, and my office, the Office of Community Living. So if you're familiar with our Medicaid waivers, we have separated our Office of Community Living into different sections. So that's how I'm going to talk about all of the different programs we have within this office. We do have 2 Medicaid programs, and we have an intake and operations section that supports the intake of these programs. So the frail elder waiver and the waiver for persons with physical disabilities, these are both home and community-based service waivers, Medicaid waivers that we provide case management for. We work with Medicaid to conduct eligibility and operational activities for those individuals applying for the waiver services. And really what these programs are to provide in-home supportive services for people who are either frail elders, so elders with ADL or IADL, so instrumental activities of daily living or activity of daily living issues, and then individuals with physical disabilities who have the same difficulties in their homes. We have our supportive services section, which helps with the home and community-based services waiver. That's kind of the ongoing case management unit. And then they also have 2 stateside programs, which are the Community Options Program for the Elderly, or COPE, and the Personal Assistance Services Program, which is called PAS. Essentially, they do not exactly mirror, but they are supposed to be similar into the functions of the waivers, but for higher income individuals, those who do not meet Medicaid eligibility requirements. And again, we provide case management service as contracted provider through Medicaid for the HCBS waivers. This section also houses our Communication Access Services Program, or CAS. We love our acronyms with the division, so we have an acronym for everything. They support individuals who are deaf, hard of hearing, and speech impaired, and so they provide service funding to different services within the community to support individuals with those disabilities. And the community services section provides funding and support to community partners. As I mentioned, we fund out $28 million a year to various nonprofits, for-profit, depending on the type of funding. And this includes nutrition services, so like Washoe County Senior Services, or Human Service Agency, the Senior Services section. They receive funding from us for their meals, home-delivered meals, transportation services, caregiver support, homemaker program, and then we have the Assistive Technology for Independent Living program, our AT Collaborative, and then the Medicare Assistance Program, which I'll talk about later.
Kim Spoon for the record.
Yeah.
Do you also, in your work with Medicaid as contracting with case management, do you also work with the group home waivers system? Is that, I don't know if that was coming up because I thought it was the other one, so I didn't see it.
Yeah, so Autumn Blattman for the record. So group home waiver is what we used to call these programs.
Well, that's why I was
yeah.
wondering. I wasn't sure if it was the same thing or.
Yeah, it's a very it's a very common term that people use when they want to apply for these waivers. So if somebody applies, for example, for the waiver for frail elders, and they are in the home, but then they need to transition to a group home because their level of care is much higher, then that is something that can be transferred over.
Do you know what the amount now is for a group home waiver? Is that something you assess as well, or is that through Medicaid? Because I don't.
Yeah, that's a great question. Autumn Blattman for the record. I don't have the information for that. It is a Medicaid set eligibility requirement. But I don't have that off the top of my head, but happy to get that to you if that's something you'd be interested in.
That's okay. I was just curious you had it. And I don't know if everybody knows, but the group home waiver is a waiver for group homes that will, if they are eligible, if they meet the Medicaid requirements, they will pay the group home this waiver, which is over and above so they're usually whatever income they have. So it's a great source for people who may not be able to afford a group home, but if they meet the Medicaid eligibility, it's a wonderful program. So.
Yeah, and Autumn Blattman for the record, I have to double check, but I'm not sure if the individual has to start out in a.
They didn't used to, so I don't know if
okay.
I don't know if they do now.
Yeah, I'm not sure if that's changed since they kind of lumped these waivers.
Yeah.
But I can check on that and get back to you because I'm curious about that as well.
Thank you.
Yeah, of course. And then lastly, for Office of Community Living, we have the planning section, which is the section that I'm in, and we're focused on strategic planning, innovations, and expansion of ADSD services. to specific populations, and then working closely with advocacy bodies, the community, and various community partners to improve access to services and pilot new resources. This includes Nevada 211, and I'm not sure if you all are familiar with that, but it is our state's information and referral directory of human services. We also have Nevada Care Connection, which I'll talk about in a second. Boards and commissions and reports fall under this planning section. And a couple of programs that we fund out to community partners, but I wanted to include today because I feel that they're very pertinent to this group, is our Medicare Assistance Program. In Washoe County, we fund Access to Healthcare Network. They provide this service through our funding, and they're free, unbiased Medicare counselors, which is an awesome service. They're able to be unbiased because they're not brokers and they're not getting paid to sell you on any specific Medicare plan, but really just trying to help people understand their Medicare options, really looking at a personalized kind of plan, right? So if you came into the office and you have specific doctors that you want to see, you have a prescription list that are your regular prescriptions that you take, or you have, specific hospitals or specialists that you would like to have covered by your Medicare plan, they can account for all of that, put it into the Medicare, I don't know what it's called, but it's some system. It's a database that's on Medicare.gov, and kind of search based off of your zip code and the service area of your providers to see what Medicare plans you qualify for. They also do scam related intervention. They look at appeals. So if you have Medicare billing that's fraudulent, or they can really appeal pretty much anything that you're looking at that you feel is fraudulent or incorrect, working with the providers. They also do fraud prevention and education, and then they do application assistance for low-income programs for prescription assistance and other Medicare costs. So October 15th is every year we have open enrollment, October 15th through December 7th for a regular open enrollment. And this is an awesome resource as we approach to open enrollment in October. One of our last resources I wanted to talk about was Nevada Care Connection. This is another service that's funded through Access to Healthcare Network for Washoe County. Through Nevada Care Connection, they provide personalized support for resource and service navigation. So we hear a lot of times these individuals who have a multitude of things that they need support with, right? Application assistance, advocacy. They need assistance trying to identify what options are available in the community. And so the navigator can sit down with you or your family, go through the different options that are available, and help you make an informed decision about what you want to do to meet your long-term goals. They do caregiver support, case management for specific populations, to your point, Andrea, the dementia population. They do gap case management for individuals with dementia or other cognitive impairments like TBIs. If they don't qualify for services through case management of other programs, they'll support the individual with that. Also supporting individuals with who are deaf and hard of hearing with case management to really connect to specific services and programs. And these are all of our addresses, but here is my contact information. If you have any questions, concerns, I'm an open office, open email, open phone policy. So if you want to just talk my ear off about something, I'm totally down for that. And with that, I will take any questions that you have.
Andrea Pelto, for the record. I'm just curious, and I'm sorry they left, but do you work with the Northern Nevada Center for Independent Living?
Yes, Autumn Blattman, for the record, we do. And I was just so excited that Lisa was here because I've seen her virtually, but I haven't met her in person. So yes, we do work with them.
Awesome.
Any other questions?
Thank you so
Thank
much.
you.
I really appreciate it.
No problem.
Okay, 6.5 presentation is Teresa Whitfield with Northern Nevada Medical Center Senior Bridges Program. Good morning.
I brought old school things. So you know. These are for the city council members, and these are for people in the audience. Good morning.
Good morning.
Thank you so much. I wanted to share with you information that's near and dear to our hearts at the Senior Bridges Program. It's been around for more than 20 years, and it is literally a hospital within the hospital at Northern Nevada Medical Center. We have 28 beds geared to adults 50 and over that are struggling with a variety of mental health diagnoses. And about 60%, sometimes 70%, of our patients who come to us have dementia with other behaviors. The part that breaks my heart that you'll see in the one handout is that many people come to us and they have no advance directive. They've not talked with family, they haven't decided what they do and don't want as part of their life when they can no longer make those decisions. And sadly, if somebody has a diagnosis of dementia, they shouldn't be signing any legal documents. So the time to take care of these things is before that happens. And oftentimes we're in the middle of trying to help family recall or remember or become the most the most appropriate advocate for their loved one. And if we have somebody who has other mental health illnesses, sometimes they don't have family left that will help them because of a variety of things that have happened in the past. And some patients with dementia, especially if it's early onset, are adult children who are now taking care of their parents as well as their children. So they're stuck in the middle of how they're going to maintain their job and take care of everyone. So helping them through this process and to literally be a bridge, that's how Senior Bridges got its name, to the next safest place for our adults who struggle with dementia is the majority of the work that we do. One of the flyers that I brought and have given to you is for the Sanford Center for Aging. And it's a grant-funded program that's associated with the University of Nevada at Reno. It's a free grant-funded program, and their assessment, they are booking assessments now in October. You don't need a doctor's referral to go. I made some notes on it for you so you didn't have to call the number and think of all the questions you wanted to ask. I asked them for you. But the group that does this assessment plan to be there for a couple of hours. It's a pharmacist, it's a gerontologist, it's a therapist, and it's also a patient care tech or CNA. And they're going to look at medications. They're going to look through, are there contraindications? Are there things that somebody shouldn't be taking that's interfering with regular prescribed medications?
Teresa, let me just interrupt 1 second, because I'm very sorry to say that the Sanford Center did not receive their grant allocation this year, and they've just discontinued that program.
I talked to them yesterday, and they have 2 other grants that are covering the program.
Are
so
they?
It is open.
Okay, because they sent out notice that they would no longer be doing that.
They're reorganizing, and
Thank you.
they'll have positions in October
Oh, that's
open.
good.
So that's why I called to make sure, because I had heard something of that at the Life Stages seminar when I was talking to the ladies there outside. Correct. And I don't know that everyone takes the time to talk to the pharmacist when they pick up a prescription, or if they do when things are changing or adding, but that's an important thing to do. And as we get older, we need sometimes a lesser amount of medications or a lesser dose than we once would have. Your metabolism slows down. I mean, I'm proof of that. I cannot eat like I used to and spit into things that I want to. The other thing is I encourage people not only to complete their advance directive, so we know when you can't tell us what you want done, but also to understand how Medicare works and how Medicare pays your bills for you when you're in the hospital. There is a deductible of $1,600 for most Medicare recipients when they go to the hospital to use their Medicare. It's a deductible like any other plan, and it's per event. So if you go to the emergency room, that's an event. If you go back 3 days later for something different, that's another event. So those deductibles still apply. The first 30 days are covered with Medicare that someone might be hospitalized at no copay. Once someone exhausts those 30 days, then their next 60 days come into play, and there's a $400 a day copay for hospitalization that's over the initial 30 days. That's for the next 60. And I'm telling you this because once you use up the original 90 days, the 30 and the 60, and go into the next 30 days, that copay is about $800 a day. And it can be very financially devastating to a family or a couple. And again, why the advance directive is important, because sometimes these days are used up as we're trying to find guardianship for someone who hasn't done any of these things. And the guardian process can take 6 months in Washoe County. That's something we're working with the Nevada Hospital Association to streamline and to greatly improve, because it is one of our biggest frustrations. I don't want to use up somebody's Medicare days that they might need later for something else. And that's a source of heartbreak for us. And the program that we have doesn't try to keep somebody with dementia in their room with somebody sitting outside. We have a pretty structured program. All meals are together, activities in the activities rooms. We have planned visitation and observation of who comes to visit. And getting a group home waiver, we can apply for that after someone's been there 30 days. There's some applications that require someone to be there a certain time before we can apply. The same for institutional Medicaid. So when you're doing open enrollment, keep all of those things in mind. Some of the Advantage plans direct where you can go for services, and some don't allow you to come to us. To go to renal behavioral health, you have to be completely independent and able to take care of all of your own activities of daily living. At Senior Bridges, we have patients that come as far west as Santa Cruz and Petaluma, as far north as Alturas and Eagle Lake, and into Battle Mountain, Winnemucca, Hawthorne, because there aren't any services geared to seniors specifically in any of those areas, unless they're independent. One of the Medicare benefits that most people have is a 90-day lifetime psychiatric days. That's strictly for outpatient, okay? It doesn't apply to anything inpatient. So anything freestanding is going to use those 90 days. Okay. So one of the programs that we have discovered is called Stronger Memory. It is put out by a foundation called the Goodwin Living Foundation. And they have free on their website a 279-page workbook. And this study started, I was told, in Japan. And they picked 100 people, and they looked at tasks people were doing while connected to some electrodes and an MRI to look at what parts of the brain were working. So they were looking at prefrontal lobe, cerebral cortex work that improves cognition and can stave off some forms of dementia or improve them. And in this study, they had their subjects, volunteers, read aloud for 10 minutes a day, handwrite 10 minutes a day or print, and do simple math, okay, 14 plus 6, things like that. And all of those work pages are in here. At 6 months, they did another cognitive evaluation and found those people had improved by 26%, which is huge. They offered for them to continue on their own to do these things, and their cognitive levels continue to improve. For people who stopped the program, they remain 26% better than when they started. They didn't lose any ground. So we're very excited about this, so much so that we are ordering some books from Amazon that are large print, where one patient can read aloud to another, kind of a book club kind of thing, and sharing with our partners in memory care and other places for this program. We are growing in need of beds, and that has prompted the parent organization of Northern Nevada Medical Center to invest in another building at Charlins Drive off of Rob and Charlins. It was Summit Ridge Convalescent Home, which closed. So they've renovated the inside. Our acute rehab department is going to move from 8 beds to 22, so people recovering from acute traumatic events that lead to other disabilities that they need help overcoming, stroke, auto accidents, things like that. There will be speech therapy, occupational therapy, physical therapy. The building is lovely and designed well for that. So rehab services is growing. And the adult behavioral health, we will grow from 28 beds to 50 beds. And we will start inviting adult as well as seniors. So we'll have an 18 to 50 area and 50 and over. And we will keep those populations separate for everyone's safety and needs. And we're going to continue to lobby on to find many more guardians that we need for our populations, and to help families navigate the system for our seniors.
Okay, Teresa, can you, so is the whole Senior Bridges moving, or are you going to stay with some beds in this hospital or not?
Everything is moving.
Okay.
Everything's
Could you
moving.
tell us how people get into the program? What do you do once you're in the program? You know, when you're there, what is it that you look for and work with and so forth?
Patients come to us from a variety of ways. Some of them come to us as a referral from a skilled nursing because they've started having behaviors either verbally or physically more aggressive, and trying to figure out why. So we look to eliminate all of the medical reasons somebody may have a change in their behavior. We look to see that their thyroid's functioning okay, that they don't have a urinary tract infection, that they're not dehydrated. So we do a lot of lab work to rule those things out. Once those are ruled out, we do the cognitive evaluation, and we figure out then what level, and if we can, what type of dementia or cognitive impairment is going on. We also look at medications currently on to see what else may work better and more affordable than what someone may be on.
And this is Kim Spoon for the record. That's all done through the ER first before they go up, or?
Some of it is direct. Some of it
Okay.
is direct from another facility. They talk to our intake coordinator, who interviews and finds out what kind of behaviors, when are the behaviors happening, how, what's the extent of those behaviors, and ask questions. We have them send us clinical notes, because oftentimes we need to get approval for their admission through insurance companies as well, unless they're a straight Medicare patient, which makes it a lot easier, and we can say, just come on over. We get people that families literally drop off at the ER and leave. And then we start to peel away to find out how best can we help. Some people are coming to us from the police department on a legal hold of some kind. We had a gentleman try to jump out of the family car while driving on the highway, and the police brought him in, and his black eye was because he was fighting with the police, so there's that. The MOST team is run by the City of Reno Police Department. They're a mobile observation specialty team. And they brought a lady to us who also in an altercation had gone out several times to a home, and someone pretending to want to help her moved into the home and was taking over the home and offering a lot of alcoholic beverages and things. And she ended up for us with dementia in protective custody while we worked with Adult Protective Services and the MOST team to find her a guardian and find her a place to be. And then the process of removing someone who wasn't family, who shouldn't have been in the home, opening the home up to other people as soon as she was gone. So there's all kinds of things that can delay us moving someone to another safe place because she couldn't safely live at home. But in order for her guardian to be able to sell her home and have her funds for her to go to a group home, took some time. Took some time in a lot of her days. So those are the kinds of things that, those are the stories we'll share with the Nevada Hospital Association to encourage Judge Walker to speed up the process for guardianship for our patients that need it.
So once they're admitted, this is Kim Spoon for the record, once they're admitted, then they're evaluated again by the psychiatrist, or how does that work?
Yes, so within 48 hours, they have a full evaluation from occupational therapy for a cognitive eval that our social worker case manager sits down to interview for as much information as we can gather about past, family, finances, anything, so that we can make sure that we can protect all of those things and leverage them to the best for this patient. The psychiatrist meets with them and sees them daily. And then we adjust and look at, like I said, medications. All of those metabolic things are screened the very first day of admission. And then they start our program, which gives them, 3 meals, a safe place to be. We have a donation closet for clothing. We don't have our patients on the adult behavioral health unit wear gowns. They're wearing street clothes. They have morning activities, breakfast. There's a group run by occupational therapy, lunch, afternoon, another activity, and visiting hours are pretty strict from 3:30 to 6:30, and turning in for the evening. So.
Right, and what is the average stay? Do you have one?
The average stay is between 11 and 24 days, and it all depends on finding the right combination of medications for somebody who's having behaviors. If we're going to send them back to a facility, we'll adjust current medications to see if that's what's needed. If we need to change to something else, we'll change those medications, and some things can't just be stopped. They need to be tapered off and something on. So safety's our primary focus. And then we're looking for 3 days without behaviors before we let someone go back. So we'll be arranging transportation and talking to the receiving and sending facility, because it's generally the same one, about how ready somebody is.
Thanks. Also, I think it's important for people to realize, sometimes it takes at least, if not longer, 2 weeks for medications, psychiatric medications, to even show whether they're working or not. And that's why I would think, an average stay of 11 to 24, it's a lot for that type of situation. But one of the, and I'm not sure it's still the same, but there is an actual law that says you cannot hold somebody in a psychiatric hospital for dementia only.
Correct.
So what they have to have is a primary diagnosis. So it would be the behavior issues, the psychiatric.
Right.
And many people you see aren't demented, but they do have bona fide psychiatric mental health issues that are also being treated, correct? And those,
Yes, we have patients with schizophrenia, with
Right.
bipolar disorder, with major depressive disorder. And we have some people that end up surprising their family. One of the people who work at the hospital, her mother and father are right here in town, and her father died suddenly, and that's when she realized how much her mother had dementia that had progressed, because he took care of everything. And he knew how to redirect her. He was doing all the shopping. She would go along, but her job was to hold on to the cart, so she didn't get lost in the market. So when he passed away suddenly the rest of the children realized how much help that they needed, and that they weren't going to be able to take care of her at home. Going back to, again, letting us know what you want done. Okay, so there are so many different situations and diagnoses, and we're really happy that there are some long-term injectable medication for some of our people who have ended up homeless because of their mental health issues, that now we don't have to worry that someone's going to steal their medication or they're going to remember to take it every day. They have a long-term injection that can last up to 60 days and get to the community health clinic for the next injection and be much more productive and safer outside the hospital. Right. Any other questions?
Andrea Pilto, for the record. Thank you so much for coming. I had no idea everything that Senior Bridges offered. I had a friend who used to work at Senior Bridges, and I knew they did like psychiatric counseling, but I had no idea the depth that, really you cover. Do you have any cards? Did you bring any cards with
Bring
you?
some cards by and get them to Kim. I have exhausted my supply, but I'm very happy to have been here today because I've learned more about other resources that we can connect in the community to be helpful to our seniors. I do want to make sure for the city, if you're looking at business licenses and things, there are some people that are running an independent living home in Sparks. They don't require a license. They charge somebody $800 a month for a room, and they're left alone in the house to do whatever they can.
I think it's 2 and under or something. They don't require a license. Yeah. Well,
Could be more. 4.
4, thank you.
More than 4. So they get a 3-bedroom, 2-bath house, and they have 3 people, and they're underneath the radar. But it concerns me that there is not as much oversight for the care of some of our people that are able to continue to live independently.
Jeannie Paquin here on the record. Isn't Senior Bridges an older program that's been used before in this area?
It's been in this area for more than 20 years.
That's what
as
I
part of the
thought.
hospital.
Yeah.
Absolutely.
I've had some
Yes.
experience with Senior Bridges about 20 years ago.
Yeah. Yeah.
So I wasn't sure if it was still here, if it was run by the same people.
Yes.
Okay, that's wonderful, because that's definitely a needed service that we need in this community.
It is. It is. And we try to stay as connected as we can with all of the other outreach and senior centers. And I think a lot of people, if they're starting to struggle with memory, are worried about going out and getting lost or being taken advantage of and those kinds of things. So I was happy for Tim's presentation about preventing scam and some of those things that we can share with our case managers, and the information that Lisa brought also for housing, because it's a big concern. It's a big concern. The most dreaded phone call is somebody calling to say, I need help because I came home from lunch, the smoke detector's going off, and Mom has the crock pot on the back burner turned on high, and I didn't think it was this bad. So trying to find help to provide for people.
Well, this is Kim Spoon. I don't know if there's any more questions, but I really appreciate you coming. We have, in my line of work before, when they first opened, I think you had 6 beds, something like that, and we filled them all. It was really, we were so happy to see someone, and you've been there all the time since, have been a wonderful savior for so many people, and I really, really appreciate you coming and sharing that. Thank you.
Thank you. And please let me know if there's anything else. I'll bring some cards for you.
Okay, thank you.
And I have some of Lisa's cards that I'll take back and share with the staff. And feel free to log on to the Stronger
program.
Memory Program. I think
Can you tell me the name of that?
Yeah, it's called Stronger Memory. It's from the Goodwin Living Foundation. You can find it online if you just Google Goodwin Living Foundation or Stronger Memory. And it's a free downloadable workbook that you can get. And we've just been shamelessly copying it for our patients to do 10 minutes of things each day to try and show our own results and improvement. Okay.
Thank you
Right.
so much.
Thank you.
Appreciate it.
Thanks very much.
Okay, 6.6 on the agenda, presentation concerning acceptance of an $11,900 AARP Community Challenge Grant to fund emergency whatever it is, go bags, providing seniors with essential items during an emergency. Yay!
Hello, Julie Dewell for the record, and I have with me Hannah from Project Bear Hugs, and we're just really excited to make the official announcement before your committee that we were awarded $11,900. It was a community grant from AARP. Basically, our application we put in, we wanted to provide go bags and information about emergencies to seniors in our community. So we were awarded that grant, and right now we are collecting items for those bags to give to 400 seniors in our community. Meals on Wheels will help us deliver 285 of those, I think, through the Meals on Wheels program. And then our fire department will keep extras on their fire trucks when they go out to emergencies. So if they see a senior that could use an emergency go bag, they will provide them the go bag there. So very excited that we were awarded that grant. July 22nd, the council approved accepting that grant. So we're really excited that we can help seniors in our community, and we think emergency preparedness is very, very important. So, and my next agenda item, I'll talk a little bit more about an event that we're going to be doing, but I wanted to see if Hannah wanted to mention anything.
I'm good.
Okay. All right. And if anybody has any questions, I'm happy to answer.
Kyle Waxman, for the record, one quick comment. Did any city council member dare to refuse the grant?
Not a one, so.
Very wise.
No, they were very, very excited about it as well, so.
Thank you. And on 6.7 on the agenda, announcement about Go Bag Stuffing Day event on September 25th.
Yes, so Julie Dewell again for the record. We are putting together, I have some flyers here for you all on September 25th from 8:30 to about 1. It'll probably be closer to about 12:30. We are meeting in the Sparks City Hall training room, which is downstairs. We are going to put together these go bags for seniors. So some of the items that we are collecting is Hannah has blankets and shawls that we'll be putting in there. We have purchased with the grant money solar crank radios that also have their chargers and for cell phones and flashlights, so they're kind of an all-in-one unit. Those will be going in there. We have first aid kits, we have personal hygiene items that'll be going in there, and then our fire department will provide some information for those bags as well. So we're going to be asking help, just kind of stuffing the 400 bags, and that will be that event. And then Scott Means from our fire department will be providing some information as well, some emergency information as well. And lunch will be provided. So, yeah.
Nice.
Yeah. So if you have any questions, I'm happy to answer.
Kim Spoon for the record. So if you want to volunteer for that, where do we go, online, or do we talk to someone?
I'm putting out information. I kind of want a Julie Dole for the record, by the way. I do want kind of a little bit of a head count so I can make sure I have enough, pizza or whatever we decide to order. So probably, if you'll email me, I would love to have this committee come for sure. If you're available and you can come, I would love to have you all there for that event. But just maybe email me if you'd like to come. And do you want me to give you? I think all of you have my email address because I'm usually giving it out. But it's jduewel@cityofsparks.us. So I probably, and then I also printed out additional flyers, and I thought maybe if you wanted to have them at the senior fair next week. So I'll have these available for you all to take over there.
This is Jeannie Piquin speaking for the record. Can I bring a crowd? How many workers do you need?
Sure. How many's a crowd? I mean,
4 or 5.
Sure. Bring them on. I would love that. That sounds great. We're going to be putting it on social media too. We had a lot of interest from people that wanted to help out. So we'll be putting it out on our social media platforms and Nextdoor and everything too. I think in the MOU for the actual grant, we had said we wanted 50 people, 50 and over to be there to help us out. So yes, we definitely need to abide by that. So anybody you'd like to bring, be
Good.
great, especially if they're 50 and over.
Great, well, thank you on that one.
Thank you.
Okay, 6.8 on the agenda. We also have a presentation with the Commission Board and Committee member regarding the Commission Board and Committee member handbook. And I think everybody has a copy of one of that there.
Right. What did I say, sir?
Yep, I think
Okay.
Yep.
Oh, Cindy, put it up there. There we go. Right. Hello, my name is Jessica Coberly for the record. I am a senior assistant civil attorney from the Sparks City Attorney's Office. And we worked with actually our Parks and Rec department to create this handbook that applies to all of our commissions, boards, and committees that advise our city council. And so I am going to try to focus on the high points because we've had a lot of presentations with a lot of really fun and interesting content, and this is probably not going to be one of those. I want to set expectations. What is involved in this handbook is really first and foremost, saying thank you, as others have said today, to all of those who are on committees like this one that provide advice and recommendations to our city council. And so we know that this obviously, even just today is a significant amount of your time to ensure that information is collected and disseminated. And so we have this handbook to help all of our commissions, boards, and committees to know both how to operate, to understand kind of where they're situated within the city and how their committee works. And then we also have kind of guidelines and expectations for folks on those committees. And so for many of you who have been involved for a long time, this will be kind of a remedial primer, but we've had, other new groups pop up and different things like that, where we want to make sure that everyone understands kind of where the groups are oriented, how that recommendation process operates, and then how best to be an effective member on those committees. So we start off giving just a quick overview where, how things function in the city. As you all know, we have a city council representing the city, adopting laws and approving the annual budget and approving contracts. And they also confirmed the appointment of our city manager, who you just got to meet today, our new city manager, who is in charge of all of the administration of the city. And so those duties include managing departments, recommending policy to city council, and also keeping the city council apprised of the financial situation. The city manager is also the one that is in charge of all of the employees in the city. And so we emphasize here, talking about city staff, that we have amazing city staff that support all of our committees, and those city staff are under the city manager. And so we've had some committees that say, hey, city staff, go do this. And one of the, directions here as well, no, that's the city manager who can make those directions. And again, we're going to be talking more about, how the recommendations come from different city advisory committees. And so your city staff, as you know, provide a ton of support to the different committees that they're assigned to. They help with the agendas and ensure reports are ready and participate in these meetings by providing background information and ensuring that they can also provide, if need be, if there's discussion of certain ideas or potential recommendations, the city staff can provide some, here's some of the positives, here are maybe some of the drawbacks of those potential recommendations. City Attorney's Office, we provide legal advice when necessary to the committees, and we also provide legal opinions to, obviously, City Council and the City Manager's Office. And then we also will draft or approve any ordinances, changes to the municipal code, and things like that. All right, and so we really want to recommend, the word I'm looking for, I have had my coffee, so I don't have her excuse, to really emphasize that these groups are making recommendations. And so there are a select few of our committees and boards, so I'll just call advisory committees, that do have decision-making authority, and those involve our building code, the Civil Service Commission, the Enterprise Advisory Fund, the Charter Committee, Planning Commission, and Tourism and Marketing. But otherwise, our advisory groups are making recommendations to the City Council on issues within their scope of responsibility. And so when we look at those responsibilities, obviously it's an honor to be selected, and it provides an opportunity to improve your community, and we're so thankful again that you all have accepted that honor. And as we carry out these responsibilities, one of the first and foremost, which we also have an opportunity today for some of the newer folks on this committee, is for the current members to provide new member orientation. And so that's, being demonstrated here today by, you all properly saying, here's my name for the record, and different things like that. But new member orientation ideally also includes explanations about how the group operates, what the responsibilities are, if there are any decisions that are pending, if there are any action plans pending, and the resources that are available. And obviously today we've had a lot of great resources provided. So some of the things we also emphasize in the handbook regarding those responsibilities are to, obviously each committee has different focuses, but when you're on the committee, you're representing both, the ward that you were selected by, or the committee or the, area of expertise that's being discussed, but ultimately your recommendations affect the whole city. So we want to emphasize that when you're making those recommendations, they're not just, this is only going to benefit this group, but we've taken into consideration everyone in the city. And so then we also talk about, being conscious of those expectations of the city council, so that the recommendations that are made, you've done your homework, these are well thought, well considered. And obviously, maybe not as important for this group, maybe on others, but we also really want to emphasize that the best recommendations come from a group that's worked well together. So we talk about in the handbook how to handle disagreements, how we can kind of increase the most productive dialogue, and that includes, knowing when some dialogue is inappropriate, or to try to center again the conversation on exactly what's being discussed. And so again, looking at those roles, we want to make sure that individuals know that you're expressing your views on programs and policies within the scope of interest. Sometimes we have, obviously in public comment and things, the discussion can expand, but, where our members are discussing on the record specifically about, what the committee is focused on. And again, thinking more to the general interest of the city as well, like obviously starting from the perspective of, what's helping the constituency we're talking about, which here is seniors, but then, keeping in mind that we have other folks in the city. And so understanding how your recommendation impacts everyone. And so then we have a couple of roles do not include. And so that's kind of, I referenced a little bit earlier, the advisory committees are not involved in the administration of the city, so they don't direct city staff or tell people to fire or hire city staff. So Julie's here for the long haul. Our committees also our advisory committees can also not take unilateral action as a city representative. So if somebody brings a complaint to you, it's not, okay, I'm going to act on behalf of City of Sparks and do X, Y, and Z. The committees can obviously, as different presentations have discussed, help guide those folks to the appropriate city resources or appropriate city departments. And so, again, that's any final approvals, so of ordinances or of programs or things like that, ultimately go up through city council. That final approval doesn't come on a advisory committee level. There's always a recommendation to the city council to take action on different items. And so we'll go quickly over chairperson responsibilities. We've seen a lot of great action from Ms. Spoon today. And so chairpersons are key to effectiveness of an advisory committee, providing the direction, but also helping balance the discussion, encouraging folks that maybe haven't discussed to provide opinions, and also ensuring that we have not necessarily one or two people being a dominant influence, and ensuring that the discussion stays on topic. Considering alternative solutions, and attempting to achieve consensus whenever possible. And correspondingly, everybody else has responsibilities on the committee, moving the meeting along, as we've seen already happen, obtaining recognition before speaking, asking clarifying questions. We have some great clarifying questions here today, and raising any concerns or objections at the meeting. And so I'll talk about that, I think, a little bit later on. But again, we want to make sure that discussion and decisions that the committee makes happen here at the committee and not in other conversations, outside of the official meeting. And we just highlight a couple other responsibilities, including when you're on these committees, listening skills are super important. We obviously have a lot of people with great ideas and wanting to share that. And then even after that, we want to ensure that everyone's active listening. You guys are doing a great job right now, making eye contact, things like that. But ensuring that, even if somebody's presenting a view that you disagree with, that you're not just listening to, make your rebuttal and respond, but really trying to understand where other people are coming from, and not kind of jumping to a judgment prematurely. And so we know that council advisory groups that have a high standard of listening do a really great job in creating recommendations out of that. And so then nuts and bolts, and we're going to talk about this a little bit more in your sole voting item for today, just discussing how all of our advisory committees follow a parliamentary procedure, which you've seen happen today. We have the call to order, and there's an agenda that we follow. And so if there's any questions about how we operate, we usually default to the Robert's Rules of Order when making motions and things like that. And so generally, all advisory committees adhere to parliamentary procedure. We are working as a city to ensure there are actual rules of procedure for each committee. And there are slight differences in different committee resolutions and how the committees were created. And so one, maybe you wouldn't necessarily know it's unique, but as we'll move to the voting item, there's an explanation of how each of you are appointed. And that's actually different, for this committee than some of the other committees. And so those rules of procedure just kind of lay out those details for you. And we'll go into more specificity about, how to raise a motion and things like that. So we'll go quickly through those. Obviously, placing items on the agenda, those can come in a variety of ways, but we want to make sure that any requests for items, it comes again at the meeting. And then the city staff, in conjunction with the chairperson of any committee, will make a determination whether an item should be agendized. Sometimes we have suggestions that are maybe outside the scope or different, and so we have to have that discussion between the city staff and the chairperson, depending on the applicable rules. Talking about a motion, we've had some of these come up today. You ask to be recognized, you make the motion. The motion should be clear and concise. Sometimes we have people with a lot of ideas, try to put that in one motion. We want to make sure that motions address a single item at a time. And then that, again, the chairperson allows for any discussion of those motions, make sure that everyone's had a chance to discuss before calling for a vote. And then this is the fun, this is the best part. I get to talk about the law. So we have the open meeting law that applies to all of our advisory committees. And one of those things is that any decision making of a committee has to happen in the public, where the public can view it. And so one thing that advisory committees often have to think about is when you meet together, maybe at Senior Fest, at other things, and you have discussions about potentially advisory committee duties, that you can have conversations, but you can't make decisions off the record. So you can't all come together, at a different time and say, hey, you know what I think we should do, and then make that decision there. And so the open meeting law, the legislative intent, again, is just that everybody makes that all advisory committee decisions are made in the public. And another key point on that, which we're doing a great job of today, which is just following that meeting agenda. And if something's not on the agenda, then it doesn't get to, just be kind of brought up spontaneously and then, having a motion on it while we're in the meeting. The motion can be made to put something on the agenda for the next meeting, and then you can have that discussion about that topic. And that way the public knows ahead of time, hey, this is what's going to be discussed. And there wasn't some sort of surprise decision or recommendation that comes out that nobody was prepared for. And so that's another aspect of open meeting law. So again, riveting discussion about the law. Any questions that you have, I'm happy to answer them now. Or if you come up with different questions later, your staff liaison knows a lot. And also we email all the time. So thank you so much.
This is Kim Spoon for the record.
Yes.
I just wanted to clarify that for our new community members and everybody, but Julie is the city liaison for the committee. So if I have any questions, then I always email or call Julie, and everybody here is free to do that, right?
Correct. Okay. Yes, again, if there's anything that you want to get on the record or anything like that, it's best to go through you as well, and then it can come from you to Julie. But if you have, like I say, questions about, hey, I want to make a motion in the next meeting, what should I do? That can also come to Julie and then to the city.
Okay. Is that clear for, okay, cool.
Sounds good.
Thank you. Any other questions or?
All right. And I'm going to hang out here because, I'm sorry, yes.
Sorry, Andrea Pelto, for the record. I know previously we've done suggestions for future agenda items. We've done it some after the meeting and not necessarily done them all during the meeting. So are we saying that if we don't say them today, then they're not getting on the agenda?
No, suggestions can come up at any time. The discussion here was just it has to go through the chairperson and the city staff.
And that was the
decide to put it on.
second part of the question is we're all going to now email Kim as acting chair
Okay.
to do that. That's a question. That's what we should do.
Yes. So the chair and the city staff make those decisions together.
Okay,
So, yeah.
thank you.
Yeah, Kim Spoon for the record. And I didn't know this either, but the chair and vice chair, but we don't have a vice chair, would normally meet with Julie and Donald Abbott over here.
Important person. The council member.
Well, as speaking as the Sparks employee, right? And we do the agenda items like a couple weeks before the meeting because she has to have it out before 10 days, right?
Yes.
10 days before the meeting, the agenda, or the announcement. So that's why, if you want to go through me, that's fine. It's up to you.
We
how
have
to-
to do that according to what she just said.
Yes. Just in terms of how the process works best to
Right.
ensure that both of you know about
Well,
it. And you can
yeah, but it doesn't have to, it can go to Julie, right? Or does it have to go through me?
Usually Julie Dole for the record, normally people have been emailing me and then I'll talk to the chair. Would you
When we go and
prefer
have
it
our
to be
meeting, and
other
that's
way?
is
That's
that
fine.
okay?
It's fine that you have that meeting. Best practice would be to CC both of you, and have, sorry, Jessica Coverly for the record. See, I need to follow the rules. Anyway.
But that's a good
I'm new,
clarification.
maybe that's
so-
an excuse. But yeah, so if those are provided, in conversation, Julie, it doesn't mean that you have to be like, hey, Julie, let's go find Kim before I can tell you this.
Right,
But
exactly.
Yes, and so but just in email, if you're, have an idea afterwards and you want to make that contact, best practice would be to include both of you. But yes, because you have that conversation.
Right.
It's okay if one of you gets it and then brings it to that conversation.
So if you do just go to Julie, she and I will talk about it anyway before when we go into the agenda item.
Yeah.
Oh, it's off, her computer's having a heck of a time. So, well, thanks.
You're so welcome.
I
And I'm going to
appreciate
stay, Jessica, come to the record, I'll stay right here because general business is me too.
Okay.
All the fun stuff. So.
Okay, 7.1 on the agenda, consideration, discussion, and possible approval of the updated rules and procedures for the Sparks Senior Citizens Advisory Committee for possible action. So does everybody have their copy here? Now, has everybody had a chance to look at it? Yeah, I'm afraid that was going to be the issue. So I'm not sure we can go ahead and vote on it because I don't know that everybody's had the chance to look at it. So I'm not sure how we want to handle that. Any suggestions from anybody?
So, I'm sorry, Julie Dole for director. Let's let Jessica do the presentation, and then we can kind of discuss it after.
Perfect. Okay, let's do that. Thank you.
You're welcome. So Jessica Coberly for the record. I'm just going to go through, and give you the top line elements of each article of these proposed rules for procedure. First of all, a background note, like I say, all of the advisory committees, including the city council, ultimately operate based on a parliamentary procedure that's based off of what's called the Roberts Rules of Order. And so those principles are baked into all of the rules of procedure for all of the different advisory committees. And that's basically in order to put something on the agenda, you make a motion, here's how to make a motion, et cetera. What's unique about the rules of procedure for your committee is that there are elements that we had to incorporate from the resolution that city council passed in order to create you. And so some of those things are, there's no presentation for this, sorry.
Oh, sorry.
Nope, sorry. This is even drier. So, so first, Article 1, right, that's going to be the same for everyone, or almost all of our advisory committees. We have one that has chosen not to meet here, but tells you the name of the committee and the office of the committee, which is located at 431 Prater. And then membership, Article 2, that's the kind of more unique part. There's more members on this committee than some other committees, and the way that those are chosen is a little different here. And so we, we specify there's a non-voting member from the city council, and there's voting members appointed by the mayor and voting members appointed by different wards. And so that differs a little bit from other advisory committees. And then again, membership talks about me, legal counsel, we provide you legal advice, your term of office, which is 3 years, and how members can be removed from the committee, which is ultimately if you never show up, we will have to find somebody else who will. And so there's a couple of specifications there. So it's saying, and that specifically is if you miss 3 regular meetings within a 12-month period. So just to keep that in mind. And then also how vacancies are addressed, which is, again, if there is a vacancy, someone steps down or their term ends, they will be a new person will be appointed to the committee based on whether it was a mayoral appointment or a council member appointment. And so we went over Article 3 a little bit with the previous presentation, officers and responsibilities, talked about the chairperson, how they preside over the meeting and preserve order and decorum, and then the vice chairperson, if one is appointed, which is not necessary, but is a process. Sorry? Oh, yes, there's no presentation for this, sorry. This is the document that's attached to the agenda item. And so this talks also about the election of officers, so that, how you elected your chairperson and how long they hold office, which is for 1 year. Subcommittees are an option if the advisory committee wants to create a subcommittee to focus on a specific issue and provide a resulting report, that your committee can do that. Article 4 is about meetings, and again, that's where I was talking about this committee meets here, other committees can meet in other parts of the city. And then talking about motion practice, which you all have observed now, you make the motion and you've got the process on your, is it tablets or, yeah, laptops. And so how the chairperson organizes that and allows for discussion. And then the public comment procedure, which again, we've seen already operating today, that the public can address for 3 minutes. There's no discussion necessarily, and anything written that they want to provide can be submitted to the city staff. And then lastly, at amendments, this Article 5 says that at the first meeting of every calendar year, there'll be the opportunity for this committee to amend their rules of procedure. Again, they're not super pretty similar amongst, so, again, that's only if an issue comes up, or if we identify, if the resolution gets changed by the city council, there may be something that we would change here. But we are trying to ensure that all of our advisory committees have applicable rules of procedure in addition to this handbook, and so that's why they're being presented to you today.
Andrea Pelto for the record. It says here, we're meeting on the fourth Wednesdays of January, April, July, and October, which is not our current schedule. So are
Okay.
we changing our schedule?
That is, I would have to double check whether that's the resolution or not, and if so, that may need to be something we update on the resolution. So that is,
Because this is August. Yes.
pardon, I'm
They're
sorry.
off by one
One
month.
month.
Yes, I understand. Okay, gotcha. Yes, so that, Julie, did you want to?
I've just had Julie Dole for the record, so I have a quick question, Jessica. So
Okay.
can they still approve that with that change
Yes.
today? Okay.
Yes. So to clarify for the meetings have been every fourth month?
They're quarterly, February, May, August, November.
Yes. So Jessica Coberly, for the record, we can approve the rules of procedure with the quarterly dates as stated.
Well, yeah, that's it. So I have a two-part question. We always have to change November's meeting because of Thanksgiving. And then, so my follow-up question is, do we want to change or can we change to these quarters instead? Is there any benefit to the committee to change to January, April, July, and October? Then we have no interference of Thanksgiving.
If that's up to the committee, if you guys want to have a discussion on that, is there any? Jessica Coberly.
Well, Kyle Waxman for the record, would that pose any problems for staff?
Julie Dole for the record, that's what I was just thinking of, because I do have our other committee that also meets. That does not mean that that's not a possibility for me. It just would mean prepping all the agendas and everything at the same months. But if it works for this committee, I'm happy to do that.
So, Andrea Pelto for the record. Also, I just want to mention one thing that I think some of us are aware of. If we're talking about Older Americans Month, is it more beneficial to have that last meeting in November rather than October for prep for Older Americans Month?
Kim Spoon for the record. On the same issue, though, if we have it in October, that lets us have it in January, which gives us more time at the first of the year. So that might be more advantageous, actually, because February just, and then it's there, right? So, I don't know. Any other input from any of the committee
Kyle Waxman
members?
for the record, it says, unless otherwise specified, so I assume we could make adjustments as needed.
Yes, Jessica Coberly for the record, yes.
Jeannie Paquin here. I think October is really a good idea. I like that idea of meeting the last one instead of November, because
Well, that would change the
November,
whole.
it
so-
would change everything. though.
Well, it would be January, April, July, and October.
Could we revert to the standard come the first of the year?
That's what we're trying to figure
Yeah,
out. So that's something you would prefer?
Yeah,
you're
I would
thinking?
like that, because I'm thinking that November really starts the major holidays, and people are coming and going, and what have you,
Right.
traveling perhaps, that might interfere with some of that.
Kim Spoon for record, does that mean we need to take a vote on it? Or is that something we can just, because it's as far
Julie
as
Dole for the record, I
changing-
think they're asking, can they still approve these as is? And then we can make that decision separately about meeting January, or should we put that in this motion to change our meetings to the January? April.
So Jessica Coverly, for the record, we can approve the rules of procedure and make this decision separately, definitely. If you have all agreed, then we can do it all at once. We can approve it with the amendment. But, because you were saying you want to approve this, potentially. But is there, I guess is there any other, are we still wanting to discuss that, or have you all decided then, do you think?
What do you think? Yeah. No, I think it.
Okay.
Andrea
Yeah, and so-
Bilto, for the record. I'm with Kyle, if it's okay with Julie. So,
Okay.
yeah, then.
Yeah, so Jessica Coverly, for the record, because the rules of procedure do set this, we can make you, when in approving it, you would be approving that change. And so if you want to do that today, that's what can happen, and then the city staff can make the adjustments with the invites and the schedule.
Julie Dole, for the record, so in this one, it's actually has the right time, so we can just approve it as is,
As is.
correct? Okay.
Okay, cool. So, do you have any more questions about this at all?
So are we reverting to the original schedule starting January again?
Right.
Right, and
That's
we're
what
just
it would-
moving
November
October.
would still be
Okay,
on the agenda.
okay.
Right? Right. Okay. So do we have a motion to approve the City of Sparks Senior Citizens Advisory Committee Rules of Procedure as written?
Andrea Bilto will make a motion to approve the City of Sparks Senior Citizens Advisory Committee Rules of Procedure as presented.
Is there a second?
I'll second, yeah.
Go ahead and put for the record, Jeannie. Go ahead and put say for the record. that
Oh,
you
for
will-
the record, I'm Jeannie Paquin, and I'll second the motion.
Thank you. Okay. Is there any other discussion before we vote? Okay, for all in favor, please vote yes.
For the record, my computer won't let me vote at all, so I'm verbally voting yes.
Verbally. Any noes? Any abstains? Okay, it sounds, let's see what we've got here. Yes, 7 say yes, and so it is passed. Thank you so much. I really appreciate, Jessica, thank you. Okay. Okay, so 8.1. Oh, well, it says 8, comments from committee
That's why I said I'll just do.
members. Any comments from committee members? Okay, then we'll go on to 8.1, request for new future agenda items. This is Kim Spoon for the record. One of the things that when I first started up to about a year and a half ago, when the person who is doing it is no longer here, is the newsletter. So I thought that might be worth putting back on the agenda to see if that's something we want to talk about or not.
Andrea Bilto, for the record, I just want to mention that not only did we lose our person, but we had problems getting the newsletter out because most of the senior residences were in lockdown or we couldn't find offices. So we were printing hundreds of newsletters and they were not getting to the seniors.
So do you think it's worth putting on the agenda item for next month?
I just wanted to mention that.
Yeah. Anyway, that's a suggestion, is the newsletter. And we can see if it's
Put
worth
that
it.
in there.
Right.
Okay.
Okay, any other agenda items that are a possibility for next meeting in November?
Andrea Bilto again for the record. I want to suggest reaching out to Good Shepherd's Clothes Closet and having them do a presentation about the $70,000 worth of clothes they give away every month.
Oh, that's good.
And I can furnish a contact for that if you need.
Okay, any other possibilities or thoughts that anybody
Kyle
has?
Waxman for the
Oh,
record.
sorry, Kyle.
Could I put two possibilities? One, we put age-friendly on, just since we haven't heard from
Oh,
them for a while.
thank you. That's.
On the agenda.
That
And
was mentioned. We were going to do that. Thank you,
And the
Kyle.
other possibility was, since we're talking about next year's Older Americans Month, put that on the agenda. So it will be
Right.
either October or November, we meet next.
Good. I love that. Thanks for the reminder on Age Friendly. That was something we wanted to do in November, after talking with Dawn and stuff, and you, so, okay.
And Andrea Pelto again, I don't know if any of these people will be available, but I'd also suggest maybe a presentation from the Vice Chair of the Circle of Life Foundation about the new hospice guest house that opened in June.
Love it. Great.
This is Jeannie Paikin speaking for the record. Do we have anything connected to the senior centers? I personally don't know what services they offer there besides the luncheons. And I would like to hear about what's going on with them. What's the latest changes?
Yeah.
Well, and maybe,
Presentation by Abby.
Yep.
Oh, that'll help that too.
Julie Dole for the record. Also, we will be holding elections in November this year, just specifically because we don't have a current chair and Kim is our acting chair. So we will be holding our elections in November as opposed to January this year. So just wanted to let you know that.
thank you. All right, go ahead.
If possible, Barbara Sterling for the record. Have we had all our council people speak? I don't remember Paul Anderson.
He was last,
Was he the last one? No.
yeah, I think he was last.
Julie Dole for the record. So normally what I do is I have a rotation of our council members, and unfortunately, our council member that was scheduled for this meeting couldn't make it, and so that's why I had Dion come to introduce himself. So usually I'll just do a rotation with council members. Did you want to add?
And I think Donald Abbott, Councilman Abbott, I guess the title. It was mentioned about Washoe County for seniors, Abby coming down. She's been on many of our agendas, but we try to lighten this one a little bit because we had so many other agenda items, and we did our best. It's still 11:20 right now. So yeah, those are great points. That normally Abby's here and she's willing to talk. And if you want to talk before that, I can always help connect.
Okay.
Great, thanks, Don. Okay, any other agenda item possibilities? Thank you very much. So then we'll go on to committee member announcements. I think, Kim Spoon for the record, the only announcement that I would want to put then our next meeting would be the 17th, which is the third Wednesday of November. Right? I think I have that right?
I didn't catch what you said.
Yeah, Wednesday, November 17th.
So that's when the next.
I have November 20th. It's a
Oh,
Wednesday.
you know what? I'm on the 21st. Thank you. That's why I wanted to I had the wrong year up. I was doing some research the other day, so I had the wrong year. Sorry.
November 20th?
Yeah,
Okay.
November 20th. Yes, I have it on there.
Okay.
Yeah.
Thank you. Appreciate that. Okay, cool.
Anything else?
That's all I wanted to make sure we all had that.
Andrea Pelto, for the record. For anybody who is not aware, Senior Fest is next Tuesday. And it's the most attended, hugest senior event that happens every year. It's at the Reno Town Mall from 9 to 2. And they also serve free lunch. So, but if you have any questions about any senior service, you can find
Next Tuesday.
next Tuesday
September 3rd.
September 3rd.
9 a.m.
at the Reno Town Mall. on Peckham Lane. Oh, I also wanted to announce for our new members and our audience that, because it's not well known, that the Sparks Senior Center is actually run by Washoe County. So we appreciate the input, but a lot of it has to run through Washoe County since the city of Sparks pays Washoe County to run that senior center. So as far as changes and things, they all have to go through Washoe County. And lastly, just a quickie, I won't go through all the statistics, but I did want to mention that the Circle of Life Foundation's guest house has been very successful, and we've already helped 10 guests and 7 have deceased.
That's amazing. Amazing. Great. Okay, any other announcements that anybody wants to bring up? Okay. We'll go to 8.3 is the staff liaison committee vacancy and general announcements.
I don't have too many, Julie Jewell for the record, I don't have too many announcements today. I did just want to remind you to invite people to the Go Bag Stuffing event on September 25th, 8:30 to about 12:30. I have 1 o'clock on the flyer. Lunch will be provided, so if you can encourage them to just kind of get an idea if they'll be coming, so I'll have a certain number, it would be great.
Can I post that on my social media?
Yes, and I can get you, I'll email you the flyer for social media in specific, so absolutely.
Thank you.
My one thing is, Chair Spoon, we have the age. I found it, and so just trying to help answer the question that was presented earlier.
Wow.
So that's the age breakdown from the item earlier heard today.
Right. That is
It is in there. It's just, it was very hard to find. When you try to search age, it brings up 256
See, I
hits.
couldn't remember seeing it.
Yeah, so it is in there. It's page 27.
Yeah.
But that's the breakdown.
Very interesting, very even.
There's
That's good.
99%.
That's good.
Yeah.
And then obviously
I
it's
appreciate
listed,
that. Thanks.
of course, if someone did not list their age, it does not account for that. But I don't have any other announcements. Just thank you all. See you at Senior Fest. I'll be a little late. I have a dentist appointment that just fell on that day. But I'll be bringing my beautiful mother. She loves it down. If you've never been, I know some of you guys have, it is standing room only. It is pure good chaos down there, but it's a great time. If you have any need, or if you know of any seniors that are in need, there's a service that's provided there, I think.
One announcement about Senior Fest, for those of you who are interested in coffee, coffee is served as soon as you get there.
Yay, good.
And Julie Jewell for the record, I am out of town next week at a conference, so I will not be there, but I'm hoping to send Andy to get some pictures of you all, so.
Thank you.
Oh, and one last thing on Senior Fest, I have put it on everyone's calendar as far as my electeds go, so they are all aware of it. So if they do not show up, it is not for lack of them not knowing. But I know a lot of them have RSVP'd, and so I'm sure they'll be there as always.
Great.
So,
Thank you.
Cool.
Thank you. Okay, so the next on the agenda is the public comments. And Mr. Metcalf, if you could wait for just a minute, we have Donna. How do you spell Klontz? I thought it was Klontz, but I wasn't sure. If you would like to come forward, please.
Thank you. Use that one too. So much stuff. Okay, thank you.
Coming up for the next, no, for the next, this one will be next year. Because I want to fix this. Okay. It's the fourth Wednesday, except for.
Apparently most of the are houses, right? Yes. Okay, great.
Morning, everybody. Thank you for the time today. My name's Donna Clance. I am the lead volunteer for AARP Nevada's age-friendly programs and also for a lot of the Northern Nevada activities that happen through AARP. I'm also a member of the Washoe County Senior Advisory Board as a longtime advisor to that group and have spent years, for those of you who are new, working in the senior field. All I wanted to do today is give you all a lot of activities that are going on in the community. Some of you have the copies of these already, but some of you are new and may not. And I gave a set of them to the clerk, and I can email them to Julie so that she's got electronic copies as well. I want to thank you for putting the age-friendly topic on your October meeting agenda. By then, Washoe County should have had the number crunch information that we've all been waiting for so long on the surveys that everybody helped collect. Over 600, close to 700 of our community's feelings about what's important to them to stay in their homes, what can we all do to improve life in whatever areas that we can to help people stay in their homes. So you, as the Sparks Board, have already processed through the AARP national system to be an age-friendly city, and you're at the stage where you're collecting data so that you, as a board, can decide what actions you want to take. So that's what's coming for all of you. So thank you for being patient and sticking with it. So Washoe County has it on the agenda again. We've missed, it's supposed to have been for the last 3 meetings. So on our next agenda, which is it'll be the 4th of September, the same day as Senior Fest, no, the day after Senior Fest, thank goodness, Wednesday, 3 o'clock, the Washoe Senior Board will be meeting, and we'll have a report from the statistician about the age-friendly survey data. So if any of you have time and can make it, it'll be there, or you can be on Zoom. And I can send the info, if you haven't got it, to Julie, so that she can let you know to attend the Zoom and listen in on what that information is. And then you can take it to your agenda in October and hopefully start to work on the next steps there too. So that'll be fun. So basically, the rest of what I wanted to get to you today is the information about all the ways that we can be advocates for our senior community. I'm going to fix the Senior Advisory Board for Sparks, put some correct dates in this little flyer, but we use this little half sheet at every tabling event that we do all over Washoe County. Anytime we're at a library and doing senior things, we let people know what's going on. So I'll let it go at that, but there are some new activities coming up. You've got a list of all the northern activities, plus a couple new ones that we've got new flyers. So thanks for the time.
Thank you very
You're
much,
welcome.
Donna.
Thank you,
Look
Donna.
forward to that. And Mr. Metcalf, did you want to continue for 3 minutes, or, okay.
Again, this is Norm Metcalf, and I'll continue. One of the things that senior citizens are concerned, or of 3 senior citizens are concerned of, is food, transportation, and the housing, as mentioned. Now, I will mention that, for example, I was not aware of STRAP. Asked her about it. They weren't aware of it either, and that's part of my point of getting some of this stuff on a, I know you talked about the newsletter, but on a resource report like Washoe County does, and need to get it worked out and published maybe quarterly or whatever. And I'm willing to talk to whoever you might assign this to, but again, it's a request that you put out a resource type pamphlet for senior citizens. So that's basically what I wanted to find out, and I think you need to have somebody assigned, at least to have of an FTE, which is a full-time employee, for your information. To handle this, as you have seen, quite a few areas to pull together for me, for example, as a senior citizen, to have the resources to know what's happening in Sparks. Okay, so I guess that's what I'm finishing is it's a request to have this considered, to have a publication. Okay, thank you.
Thank you very much.
This is Jeannie Pickwood. Mr. Metcalf, I'd like to.
There are no weeklies in public, yeah.
Yeah, it's
Sorry.
public comment.
Yeah.
So, and if you need to put it on the agenda, might ask that.
Thank you so much.
You're welcome.
Okay, if that's the end of public comment? You have 3 minutes, right?
Pamela Baker again. Since the city of Sparks and we citizens are paying for Washoe County to operate our senior center, then we should have something to say about how they are operating that senior center. Also, Norm brought up the point earlier that according to the last census, there are approximately 30,000 seniors in the city of Sparks. That's a huge increase from when our senior center was built, which I believe was in 1950. Our current senior center is not meeting the activity needs of our seniors, as I have found out in the time that I've been going there. They just don't have the space. So I'd like this committee to make the recommendation to the city council that the city council look at expanding our facility because we own that building. We do not operate it, but we own it. And clearly, we need a far bigger facility. The other thing is that according to all the public projections, City of Sparks is going to be bigger in population than Reno. So we need to start looking ahead because we're not meeting the needs of our senior citizens at this senior center currently, and we're definitely not going to meet them in the future if we don't start acting now. Thank you.
Thank you very much.
You're welcome.
Expansion. All right. If there is no other public comment, then we will call this committee to what? To close? To adjourn. There we go. To adjournment. So, thank you so much. That's it. Do we have to say the time or anything when we adjourn? Okay.